Co-occurring disorders must be assessed, diagnosed, and treated alongside sex addiction. There are people out there who, they've tried to get into good recovery for years, 2 years, 4 years, 7 years, 10 years. A lot of these folks have come to our practice and they're saying, I don't know what's going on. I do the groups, I do the books, I do the 12-step stuff, and I'm not getting better. I'm not getting better. And here's what I would say. Most of the time, what we find out, what we discover, is that these are individuals who are dealing with more than just sex addiction. I'm not saying just there in a minimizing way. I'm saying that there's something else on board. It's not sex addiction in isolation. There's another co-occurring disorder. Maybe it's depression. Maybe it's PTSD. Maybe it's a personality disorder. There's so many things that could be going on. Maybe they're on the spectrum, but there are lots of things that are going on that we need to understand so that we can actually help the person get the results they want. I get to teach at Houston Graduate School of Theology, which is part of Kairos University in their graduate program in counseling. And what I always say to my students, I just drive it home in almost every class. I say this at some point. If you're not getting the results you want in treatment, right? If you're not hitting the goals, the treatment goals, you have to look at the treatment plan. Am I executing the treatment plan? And if you look at that and you say, well, yeah, I am executing the treatment plan and I'm not hitting the goals, now you have to go, wait a minute, what's this treatment plan based on? Well, it's based on a diagnosis. So I have to look then, okay, well, is my diagnosis reflected in the treatment plan? Are they appropriately linked? And if the answer is yes, the diagnosis, I came up with sex addiction and I'm doing a sex addiction treatment plan, but I'm not getting the results. Now I have to go further back in that chain, and further back in that chain is assessment. Did I assess for other issues? Is there more going on? And if I go back to that assessment and I go, is there something more? And I discover, oh, wow, you know what? Maybe there's some obsessive compulsive personality disorder here. Or, you know what? Maybe this person does have some PTSD that is a separate issue from, not entirely separate because everything's interrelated, but, from the sex addiction. And now we integrate the treatment of that co-occurring disorder. Now we begin to see results. We've seen really amazing things happen when we discover that there's a co-occurring disorder. And what we're able to do is we're able to change the treatment so that both things are being treated, and then we often begin to see the results that we want.